Hello, my name is Ashley Parham. This is my public service announcement for pregnancy and prenatal care, Nursing 444, Spring 2020, Professor Dr. Lucky, Indiana State University. I have included a pretest if you will take a minute and complete the pretest. Thank you. The population at risk is pregnant women of all ages. I have also included a pregnancy and prenatal care handout that highlights the learning objectives. The learning objectives are: what is prenatal care? Why is prenatal care important? Benefits of prenatal care, and consequences of no prenatal care. The handout also highlights the content, and the content is Introduction to Prenatal Care, where prenatal care can be obtained, benefits of prenatal care, consequences of no prenatal care, complication statistics of no prenatal care, education for expectant mothers, and resources for expectant mothers. So you may be wondering, what is prenatal care? Prenatal care is health care that a woman gets while she is pregnant. Early and regular prenatal care can help moms-to-be and babies stay healthy. Receiving regular prenatal care allows doctors to detect and deal with any complications early on and improves complication outcomes. Prenatal care is offered by obstetricians, family practitioners, and certified nurse midwives. A pregnant woman should have her first prenatal appointment within the first 6 to 8 weeks of pregnancy. Checkups after the first appointment should be every 4 weeks until the 28th week of pregnancy, then every 2 weeks until the 36th week of pregnancy, and finally once a week until delivery. The length of a pregnancy is split up into 3 trimesters. The first trimester is week 1 through week 12. The second trimester is week 13 through week 26. And the third trimester is week 27 through week 40. Learning you are pregnant can be a scary and exciting time. And learning that you need to go to doctor's appointments is just an added thing to your list of things you need to do. So you might be wondering what happens during a prenatal care visit. So during the prenatal care visit, the nurse will check and record your weight and blood pressure. The doctor will measure the size and shape of your uterus and will make sure those measurements correspond with the appropriate point in your pregnancy. Starting at approximately week 12, the doctor will use a handheld Doppler to listen to your baby's heart rate and make sure it is strong, normal, and at a normal rate. You will need to provide a urine sample at each visit to test for protein and glucose in your urine. These can indicate problems of increased blood pressure during pregnancy and gestational diabetes. And starting at week 36, the doctor may do a vaginal exam to check and see if your cervix has begun to soften or dilate to prepare for the birth of your little one. Prenatal appointments are very important to help detect complications that can arise during pregnancy. So what complications can be detected during a prenatal visit? High blood pressure, gestational diabetes, abnormal fetal development, abnormal fetal heart rates, abnormal maternal weight gain or loss, congenital abnormalities, placental issues, preterm labor, loss of pregnancy, and fetal death. So you may be asking, what happens if I don't go to my prenatal appointments? So it's been shown that women in the United States who do not receive prenatal care are at increased risk of neonatal death. Lack of prenatal care is associated with a 40% increase in the risk of neonatal death, and the risk doubles if the baby is delivered at or before 36 weeks gestation. And infants born between 24 to 35 weeks gestation to a mother without prenatal care are 20% more likely to die within their first 27 days of life than those who were born to mothers who did receive prenatal care. These are scary consequences that could happen if you don't take the responsibility and take care of yourself and your baby while you're pregnant. So since we've looked at the consequences of prenatal care, what are the benefits of prenatal care? So the Centers for Disease Control and Prevention have come up with what they call PRAMS, or Pregnancy Risk Assessment Monitoring System. This was developed in 1987 and collects state-specific population-based data on maternal attitude and experiences before, during, and shortly after pregnancy, aimed at reducing health problems among mothers and babies. Early detection of pregnancy complications and fetal complications helps to decrease the negative effects of these complications on the mother and baby. And prenatal care helps mothers all over the world have healthy pregnancies that end in smooth deliveries of healthy babies. As I mentioned before, becoming pregnant is scary and exciting all at the same time. And you may be getting mountains of information and not know where to turn or what to look for next. But there are resources for expectant mothers that's important to know about. So most states offer Medicaid to expectant mothers who qualify. Medicaid is insurance that can help expectant mothers pay for their doctor's visits, medications, and delivery and hospital stay. Most states also offer a program called WIC, which is Women's, Infants, and Children, that provides food, healthcare referrals, and nutrition education for low-income pregnant and postpartum women, infants, and children up to 5 years of age who are at nutritional risk. The United States Department of Health and Human Services Maternal and Child Health Bureau coordinates medical care, support, and advice for pregnant women, as well as information about health insurance, and their phone number is 1-800-311-2229. Your local health department can also provide or direct you to available resources, and your obstetrician, family doctor, or nurse midwife can also direct you to available resources. This concludes my presentation on pregnancy and prenatal care. I have included a post test if you would like to test your knowledge of what you have learned today. Thank you.